Hi, I'm Respicious Shumbusho Damian, a Kata graduate from University of Dar es Salaam, Tanzania. My presentation is titled Community-Based Monitoring. Does it work? This presentation summarizes the findings of my entry research project, which was actually based on the findings of my PhD work on financial accountability in rural primary health care. I realized from my research, my PhD research project, that financial accountability, which was a challenge, was actually affecting health outcomes and service delivery in rural Tanzania. I therefore tried to propose the community-based monitoring approach, which had worked in other communities, in other rural communities in countries like Uganda, Mali, Bangladesh, and India, as a solution that has to be tested. Now, the community-based monitoring approach is defined as an oversight approach within the communities, by the communities, and for the communities themselves, and also driven by community needs, relying on available resources, and involving continuous monitoring and learning in form of partnership, where there are virtues like trust and decision by consensus. So, we wanted to assess the effect and feasibility of community-based monitoring as a means of improving accountability in rural primary health care. And our selected variables were urgency, service delivery, responsiveness of primary health care services, and improved community partnership. We used household surveys and community engagement approaches such as community dialogues and joint reflection sessions and learning sessions to monitor and assess the changes in those variables. So we found that there was significant improvement in terms of urgency to participate, and especially the realization that the communities have the right and building confidence to question. And also, the improvement was relatively significant in terms of improving community partnership, in terms of collaboration and working together to find out the solutions for the existing challenges. But it was somehow low in terms of service delivery and the responsiveness of government authorities. Now, what does this mean? It means that building urgency, improving urgency, cannot work on itself without repositioning the service providers and government institutions to respond to the needs and interests of the communities. We also realized that solidarity was actually improving because of the CBM, the realization that they don't need to blame each other, but they have to collaborate to solve the problems, because none of them were the cause, but they were all a solution to those problems. We also realized that communities were taking responsibility and ownership, therefore the readiness to address the existing challenges, and also there was an improving trust in scientific research and scientific solutions, especially the methods, and the realization that the communities, the lay communities, can do what we call science. So if they are facilitated and guided, they can come out with evidence-based solutions. We also realized that normalization actually embedding interventions in the existing practices of the communities was cheap and also improved acceptability and the uptake of the interventions. And finally, we realized that there is a need for safer engagement spaces, and this actually relates to the point that the existing participatory forums have to be free and away from the vicinity of authority and institutionalized power. Thank you for listening, and welcome to watch more videos on the links that are provided in this slide. Thank you.